Welcome to Study Session 12, Psychotherapeutic Approaches in Clinical Psychology. Introduction. The duty of the clinical psychologist is to change maladaptive patterns of thought and of behavior of people to more adaptive patterns. There are, however, different approaches that can be adopted for this change to be accomplished, depending on each clinical psychologist's theoretical perspective or expertise. Psychological therapies are usually built on personality theories, which fall mainly into four categories of psychoanalytic, humanistic, behavioral, and cognitive. In this study session, you will learn psychotherapy, counseling, and guidance, common psychotherapeutic approaches in clinical psychology, and skills needed to use psychoanalytic, humanistic, behavioral, and cognitive psychotherapeutic processes. Learning outcomes. At the end of this study session, you should be able to 1. Explain psychotherapy, counseling, and guidance. 2. Discuss common psychotherapeutic approaches in clinical psychology. 3. Highlight skills needed to use psychoanalytic, humanistic, behavioral, and cognitive psychotherapeutic approaches. Clarification of the terms psychotherapy, counseling, and guidance. Psychotherapy is a method of treatment which aims to help the impaired individual by influencing his emotional process, his evaluation of himself and of others, his evaluation of and his manner of coping with the problems of life. It may include, if need be, influencing and changing his environment and thus altering the problem he has to deal with, and simultaneously increasing his potentialities of mastery and integration. In its classic sense, psychotherapy is defined as the restructuring of the malfunctioning personality. It can also be defined as a psychological process occurring between two or more individuals in which one, the therapist, by virtue of his position and training, systematically to apply psychological knowledge and interventions in an attempt to understand, influence, and ultimately modify the psychic experience, mental function, and behavior of the other, the patient or client. This form of interaction is distinguished from other relationships between two people by the formality of a therapeutic agreement, whether explicit or implicit. The specific training, skill, and experience of the therapist, and the fact that the patient or client, either voluntarily or by coercion, has come to the therapist seeking professional therapeutic help. From the above definitions of psychotherapy, you will notice that a professional who is professionally competent, skilled, and knowledgeable to do psychotherapy is the clinical psychologist who has the knowledge of the theories of psychopathology or behavioral disorders. However, the psychiatrist may sometimes do psychotherapy, but specifically, the psychiatrist uses or administers physical treatments such as chemotherapy and ECT, electroconvulsive therapy. Counseling and guidance. Counseling has been defined by Boy and Pine, 1969, as a face-to-face, person-to-person relationship in which a person, the client, seeks the help of or seeks to effectively communicate with another person, the counselor. A relationship characterized by mutual respect, effective communication, genuine and complete acceptance of the client by the counselor, and concentration on the needs, problems, and feelings of the client. A relationship which facilitates growth and change in the client to become more freely and fully functioning. A professional service based upon a substantive rationale that reflects philosophy emanating from theoretical and empirical considerations of men, human behavior, and society. Wagon, 1976. after completing an analysis of how the word counseling is used, distills three themes which generally recur. Counseling is a person-to-person form of communication marked by the development of a subtle emotional understanding, often called empathy. It is centered upon one or more problems of the client, and it is free from authoritarian judgment and coercive pressures by the counselor. Two broad processes considered in counseling by individuals to stimulate. 1. Evaluate yourself and the opportunities. Make a feasible choice in the light of his unique characteristics and opportunities. Accept responsibility for his choice and initiate a course of action consonant with his choice. Counseling is a learning-oriented process carried out in a simple one-to-one social environment in which a counselor, professionally competent in relevant psychological skills and knowledge, seeks to assist the client to make appropriate to the latter's needs, to learn more about himself, to learn how to put such understanding into effect in relation to more clearly perceived, realistically defined goals, to the end that the client may become a happier and more productive member of his society. Counseling, therefore, stresses more rational planning, problem-solving decision-making, intentionality, prevention of severe adjustment problems, and support for situational pressures arising in the everyday lives of normal people. Psychotherapy, in contrast, is defined as more inclusive re-education of the individual. The basic aim of psychotherapy are to gain perceptual clarity and change, to integrate insights into everyday behavior, and to cope with intense feelings originating in past hurtful experiences. Those professionals who can counsel include the clinical and counseling psychologists, the educational and school psychologists, and so on. Guidance. Guidance is a process of information given to an individual, thus providing him with a diversity of choice. The guidance worker does not help the client with choice processes. The image below showing how guidance works. The various types of guidance include 1. Career guidance. 2. Marriage guidance. 3. Vocational guidance. And 4. Occupational guidance, which involves total systems of living involving entire life of self and family. Broadly, however, guidance can be defined as a process, developmental in nature, by which an individual is assisted to understand, accept, and utilize his abilities, attitudes, and interests, and attitudinal patterns in relation to his aspirations. It is important to note that counseling and guidance are two different things. For example, counseling is a more personalized process than guidance. Counseling is equally more private and confidential than guidance. Counseling aids growth, independent thinking, and self-reliance. Those who can offer guidance services include guidance counselors, educational psychologists, and so on. Psychoanalytical and psychodynamic therapies. The focus of psychoanalytical and psychodynamic therapies is an insight and is based on discovering an individual's unconscious thoughts and perceptions that have developed throughout their childhood and how these affect their current behavior and thoughts. Sigmund Freud, who first developed this method of therapy, believed that mental disorders were caused by early traumatic experiences. During early forms of psychoanalysis, patients typically lay on a couch with the therapist sitting out of view in order to reduce patients' inhibitions and allow freer access and expression of unconscious thought processes. Treatment was based on uncovering unconscious feelings and drives that gave rise to maladaptive thoughts and behavior, using a technique such as free association in which the patient says whatever comes to mind, and dream analysis, in which the therapist interprets the hidden meaning of dreams. Freud calls whatever interrupts the process of analytic work resistance. Indicators of resistance are behaviors such as being late, missing a session, refusing to speak about thoughts, or avoiding a particular issue. In a simple and practical sense, resistance results from fear of having to face and relinquish one's anger victim. The general goal of psychoanalysis is to help the patient gain insight or develop a better understanding of their own psychological processes so that they can be freed of disturbing symptoms emanating from these unconscious influences. Some of Freud's original ideas have since been reformulated to various adaptations, which are collectively known as psychodynamic approaches. Skills needed to use psychoanalytic, humanistic, behavioral, and cognitive psychotherapeutic approaches. Humanistic therapy emphasizes personal experience and belief systems and the phenomenology of individuals. The goal of the therapy is to boost self-fulfillment by helping people grow in self-awareness and self-acceptance. The clinician focuses on the present and future instead of the past, conscious rather than unconscious thoughts, and on helping the client take responsibility for his or her feelings and actions instead of uncovering the hidden determinants of feelings and actions. This is a deliberate change from both psychoanalysis and behavioral therapies, where the patient is diagnosed and treated by a doctor. Instead, the client consciously and rationally decides for themselves what is wrong and what should be done about it. The therapist is more of a friend or counselor who listens and encourages on an equal level. Therapies that adapt the humanistic exploration orientation include the client-centered approach, Gestalt approach, existential psychotherapy. The client-centered approach, also known as person-centered therapy. This is a non-directive form of talk therapy that was developed by humanist psychologist Carl Rogers during the 1940s and 1950s. Self-direction plays a vital role of client-centered therapy. Mental health professionals who utilize this approach strive to create a therapeutic environment that is deeply understanding, empathic, accepting, having unconditional positive regard, and genuine, congruent. Empathetic understanding refers to the therapist's ability to understand sensitively and accurately, but not sympathetically, the client's experience and feelings in the here and now. Unconditional positive regard demands a complete acceptance and support from the clients, irrespective of whatever feeling is being exhibited: confusion, resentment, fear, anger, courage, love, or pride. Congruence indicates that a therapist is authentic and does not have a facade, like psychoanalysis, that is, the therapist's internal and external experience are one and the same. The goal of this is to allow the client to gain a clearer understanding of their own inner thoughts, perceptions, and emotions, and change their behavior through self-direction. At one level, Rogers' theory and work is very simple to describe. However, using the approach can be very difficult in practice because the approach does not use techniques but relies on the personal qualities of the therapist to listen, accept, and build a non-judgmental and empathic relationship. Gestalt therapy. This was developed by Fritz Perls, Laura Perls, and Paul Goodman in the 1940s. At the core of Gestalt therapy is the holistic view that people are intricately linked to and influenced by their environment, and that all people strive towards growth and balance. Gestalt therapy is similar to person-centered therapy in this way, as well as in its emphasis on the therapist's use of empathy. understanding, and unconditional acceptance of the client to enhance therapeutic outcomes. According to Gestalt therapy, context, affect, experience, and a person cannot be fully understood without understanding his or her context. With this in mind, Gestalt psychotherapy recognizes that no one can be purely objective, including therapists whose experiences and perspectives are also influenced by their own context, and practitioners accept the validity and truth of their clients' experiences. Gestalt therapy also recognizes that forcing a person to change paradoxically results in further distress and fragmentation. Rather, change results from acceptance of what is. Thus, therapy sessions focus on helping clients learn to become more self-aware and to accept and trust in their feelings and experiences to alleviate distress. Gestalt therapy sessions do not follow specific guidance. In fact, therapists are encouraged to use creativity in their approach with clients, depending on context and the personality of the current client. What is consistent is the emphasis on process, what is happening, and content, what is being discussed. The emphasis on what is being done, thought and felt at the moment rather than on what was, might be, could be, or should be. Distinction between direct experience and indirect or secondary interpretation is developed in the process of therapy. The objective of Gestalt therapy, in addition to helping the client to overcome symptoms, is to enable him or her to become more fully and creatively alive and to be free from the blocks and unfinished issues that may diminish optimum satisfaction, fulfillment, and growth. Existential psychotherapy is a therapy that emphasizes the whole human condition. It appreciates and acknowledges human capacities to build meaningful experiences of relationship, love, commitment, courage, creativity, power, will, self-actualization, transcendence, and so on, without naively denying the inherent limitations and challenges of being human, such as the experience of death, finitude, fate, freedom, responsibility, loneliness, loss, suffering, meaninglessness, and malevolence. Existential psychotherapy. This is concerned with more deeply comprehending and alleviating as much as possible all of our negative emotional experiences that result in maladaptive behavior in order to promote positive change, where this is possible, or the acceptance of oneself and situation where we can do nothing to change the situation, to enhance the living of life to the full moment by moment. It emphasizes coming to terms with reality and one's own inner fears without denying, avoiding, distorting, or sugarcoating it is key to existential therapy. Existential psychotherapy teaches people to face and accept their fears and equip them with the skills necessary to overcome them through action and the assuming of responsibility for one's feelings and actions or inactions. The emphasis never dwells on the past, but uses the past experience as a tool to promote freedom and newfound assertiveness. Key existential psychotherapists are Friedrich Nietzsche, Soren Kierkegaard, Jean-Paul Sartre, Rollo May, James Bugental, Viktor Frankl, Irving Yalom, Kirk Schneider, Stephen Diamond, and Michael Heary. Cognitive Behavior Therapy, CBT. Cognitive Behavior Therapy, CBT, incorporates theory and research on cognitive and behavioral processes. Cognitive therapists believe that irrational thinking or faulty perceptions cause dysfunctions. Aaron Bex is a foremost cognitive therapist focused on changing certain thought patterns, The premise in Beck's words is that the way you perceive situations influences how you feel emotionally, and so by changing thoughts, then behavior will also change. For example, a person with depression may focus exclusively on negative happenings and ignore positive ones. Imagine that a woman's romantic partner both praises and criticizes her. If the woman attends to the praise and remembers it the next day, she is likely to feel happy. But if she focuses on the criticism and continues to dwell on it the next day, she is likely to feel unhappy. Beck's therapy addresses thought biases by trying to persuade patients to change their opinions of themselves and the way in which they interpret life events. When a depressed person expresses feelings that nothing ever goes right, for example, the therapist offers counterexamples pointing out how the client has overlooked favorable happenings. The general goal of Beck's therapy is to provide people with experiences both inside and outside the therapy room that will alter their negative schemas, enabling them to have hope rather than despair. This type of therapy is often effective for clients suffering from depression or anxiety. Behavioral therapists focus on changing observable problematic behaviors that have been ingrained through years of reinforcement. A good example of behavioral therapy would be a therapist working with a client to overcome a fear of heights. The therapist will encourage the client to gradually face their fear of heights through experience. The client might first imagine standing on the roof of a tall building or riding an escalator. Then the client would slowly expose themselves to greater and greater levels of their fear until the phobia diminishes or disappears entirely in a process called systematic desensitization. Other forms of therapy. Group therapy is a form of psychotherapy where two or more clients work with one or more therapists or counselors. This method is a popular format for support groups, where group members can learn from the experiences of others and offer advice. This method is also more cost-effective than individual psychotherapy and is oftentimes more effective. It is common for those suffering from a mental illness or problem behavior to feel alone, isolated, or different. Group therapy can help clients by providing a peer group of individuals that are currently experiencing the same symptoms or who have recovered from a similar problem. Group members can also provide emotional support and a safe forum to practice new behaviors. Group therapies vary greatly in types of patients enrolled in the group, duration of treatment, size, and structure. Art therapies involve the use of creative arts such as music, art, drama, and dance in a therapeutic environment. The clinician can sometimes get much deeper sense of how a client is feeling and thinking when the client expresses their feelings through drawings, music, or even dance. Family systemic therapy emphasizes the role played by client's patient's family or social network in recovering from mental disorders. The therapy views the individual as part of a larger context, and any change in the individual's behavior will affect the whole system, and a change in the system will affect the individual. This is often most clear at the family level, where each person plays a particular role and interacts with other members in specific ways. In the course of therapy, the way the individual thinks, behaves, and interacts with others may change, and this change could have profound effects on family dynamics. Summary of study session. In this study session, you have learned that 1. Psychotherapy is a method of treatment which aims to help the impaired individual by influencing his emotional processes. 2. Counseling has been defined by Boyd and Pine, 1968, as face-to-face, person-to-person relationship in which a person, the client, seeks the help of or seeks to effectively communicate with another person, the counselor. 3. Guidance is a process of information given to an individual, thus providing him with a diversity of choice. 4. Sigmund Freud, who first developed this method of therapy, believed that mental disorders were caused by early traumatic experiences. 5. Humanistic therapy emphasizes personal experience and belief systems and the phenomenology of individuals. 6. Cognitive behavior therapy, CBT, incorporates theory and research on cognitive and behavioral processes. We have come to the end of study session 12. Thanks for listening.